Lawmakers in Washington are still debating whether to continue expanded subsidies that would help lower health insurance premiums for millions of people who buy plans through the Affordable Care Act marketplace. Now, new data is giving us new insight about how many Texans are still relying on the ACA to get health coverage. And joining us now to talk more about data and what it shows is Charles Miller. He is the Health Policy Director for the nonprofit Texas 2036. Welcome.
Thank you. Appreciate the opportunity to talk about this with you and your viewers.
Of course. So last year, Texas saw record enrollment through the ACA of nearly 4 million people. What do the latest numbers show?
So what we have is a snapshot as of January 3rd. And as of January 3rd, when there was 12 days left in the open enrollment period, we have seen enrollment of over 4.1 million. So even from last year's total numbers, that's an increase of about 150,000 people more covered than they were in the year before. Now, those are early numbers, and that is people who have made plan selections on the ACA marketplace. The other number that we're going to be watching for comes out next month, and that's what's called effectuated enrollment. That means when people actually get their first bill, do they make a payment?
So how would you say that this ongoing debate over extending those subsidies affected signups this year?
So there's been two big trends, and really how those expiration of those enhanced subsidies impacts you depends a lot on who you are, and it affects you very differently. The people that are getting hit the hardest by the expiration of these subsidies are those who make over 400% of the federal poverty level. Now in Texas, that's about 125,000 people who are enrolled at that level. And that's an income level that if you're an individual is about $60,000 a year, if you're a family of four, it's about $120,000 a year. Those people are losing eligibility for their subsidies entirely and will be hit very hard. But that's only about 3.5% of the total enrollment in Texas. Now, for the rest of the 95% or so of individuals who are enrolled who are receiving subsidies, they will see their expected family contribution to premiums go up slightly. But what we also see, and this is where the good news is that value for those people is still quite good. And we think that that incredible value that is out there, when we're seeing about 3 million of those last year enrollees are still qualifying for a free plan, and about 1 million of our uninsured population is qualifying for a free plan.
We saw an interesting idea on the Texas 2036 website. Your team wrote that all policy is health policy. What does that mean to you? What policies does Texas 2036 advocate for?
So when we look at what impacts health outcomes, there's this idea, the experts call it non-medical drivers of health, but really it's this idea that a lot of what makes you healthy isn't determined at the doctor's office. It is the air you breathe. It's whether or not you're well employed. Are you out there exercising? Do you live in a safe neighborhood? And so Texas 2036, we work at a lot of areas outside of just the delivery of medical services. We work on making sure that the infrastructure is there, that there's safe drinking water available, that we have a vibrant economy to provide the jobs, and a good education system to provide the education, that are all of these factors that lead to healthy outcomes, not just seeing the doctor.
On Thursday, we saw President Trump announce an outline for new healthcare legislation. One goal is to lower costs. Are there things in that plan that match what you're pushing for?
So the plan doesn't have a whole lot of details, but we think directionally it's very much in line with what we call our healthy markets approach. And that healthy markets approach is trying to make sure that our healthcare markets are delivering affordable care so that people can get the care they need when they need it at a price they can afford. And the components of a healthy market are one that is informed, so we have to have transparency around price and quality, that's competitive, so there's options for people so that they can choose what care is right for them, and that's engaged. And this is maybe the hardest part, and this gets into a lot of the complexities that always bedevil these policy debates, but it gets into how plan designs are done and where the contracting disputes are. At the core of this, though, is making sure that there is alignment of interests, that healthcare providers are incentivized to deliver low price, high quality care, and that patients are incentivized to seek it out.
All right, Charles Miller from Texas 2036. Thanks for joining us.
Appreciate your time as always.
Big changes could be coming for Texas hemp businesses, including huge fees and a ban on popular products.
So it would mean that I have to completely turn down and either close my businesses or relocate them to other states.
Critics call it a business killer, but supporters say it's necessary regulation. We break down the debate